A story in the past that tells about a person who uses a spirit duplicator for 6 to 8 hours for 2 days. He complained headache, nausea and visual disturbance. Upon examination, his breath has a faint solvent-like smell. Then doctor could refer symptoms to methanol vapors in the duplicator. We are talking about methanol toxicity. Methanol is known as methyl alcohol or wood alcohol. It has some specific characters as it is the simplest alcohol, which being volatile, colorless, and flammable. Methanol exists in our life in many sources as it is used as a raw material for manufacturing of chemicals such as fuels. It is used as a common laboratory solvent and it is useful in HPLC. It is also used for production of paints and explosives. Methanol is absorbed from the buccal, esophageal, gastric and intestinal mucosa. It delays gastric emptying and it can be detected in the blood within 5 minutes. It is distributed throughout the body water about 95%. When methanol enters the body, it is metabolized to formaldehyde by alcohol dehydrogenase and then it is metabolized into formic acid by aldehyde dehydrogenase. Formic acid is poisonous for CNS and may cause severe symptoms like blindness, coma, and death. The toxic effects of methanol begin hours after its ingestion. There are initial symptoms which are CNS depression, nausea, vomiting, abdominal pain, dizziness, and it may cause headache and confusion. After the initial symptoms have happened, there are second symptoms that arises from 10 to 30 hours if the case is not treated. These symptoms may include blurring of vision, metabolic acidosis, and complete loss of vision. There are other symptoms that may be accompanied with methanol toxicity. These symptoms may be seizures, ataxia, confusion, headache, tachypnea, vertigo, muscular weakness, and acidic urine. There are serious complications for methanol toxicity if the case is unmanaged well. These complications are like loss of vision due to ocular injury at first and eventually irreversible optic neuropathy and blindness. For the management of methanol toxicity, firstly we make supportive care by keeping the patient in the right position and the airway clean, then check the breathing and the circulation of the victim and giving oxygen supply if it is necessary for the case. An important step of managing the toxicity of methanol is giving an antidote. Ethanol is used as an antidote for methanol that combat with it for alcohol dehydrogenase, thus reducing the production of toxic metabolite. It is given orally or IV. Fomepizole is another antidote for methanol. It is considered as competitive inhibitor for alcohol dehydrogenase, but it has advantages over ethanol like it doesn't cause liver toxicity, CNS toxicity, or it doesn't cause hypoglycemia. Hemodialysis is another step for management of methanol toxicity. It is used to remove alcohol and its toxic metabolites. It also reduces duration of antidotal treatment. This method is effective to clear the body from toxins. Using sodium bicarbonate is an important step in management of methanol toxicity. It is used to correct the metabolic acidosis and to increase the renal excretion of formate. Another use of sodium bicarbonate is to inhibit precipitation of calcium oxalate. There are other steps to manage the toxicity like using folic acid to enhance the conversion of formate to carbon dioxide and water. Alkalinization of urine is an important step to enhance excretion of formic acid. There are many people at risk, like persons having prolonged skin contact with methanol, persons with alcoholism, and folate deficient persons who are at increased risk of toxicity after methanol exposure.